Assessment 5, Assessing the Problem, Intervention Presentation and Capstone Video Reflection. Intervention Presentation and Capstone Video Reflection. Good morning. My name is Lisa Cordova. This is my intervention presentation and capstone video reflection. I will discuss a diabetic patient's intervention and use of evidence-based practice. This intervention was to focus on the patient's quality of life and the medical and educational interventions to improve her quality of care. By doing this, patient will be satisfied in her care, be more likely to be compliant with her treatment plan, and have a better self-management of her medical needs. In this video reflection, I will discuss the need for education from nursing, how to treat diabetes through medication compliance, have a healthier lifestyle, and explain how compliance of monitoring her blood glucose and proper management of her diabetes could help her condition. Contribution of intervention to patient satisfaction. The project is about a patient named Jessica, age 49, suffering from diabetes type 2 disease, and was admitted to Northwest twice in 2 months. She was also facing cardiac issues, vertigo, depression, and numbness due to the mismanagement of treatment provided by inexperienced and less educated nurses. In addition, she was suffering from an obesity issue due to a lack of self-care management because nurses did not guide her properly with proper diabetes education. I conducted a 2-hour practicum taking consideration all the ethical rules. Jessica was combating high glucose and cardiovascular issues. She struggled to follow a proper balanced diet that was moderate in carbs and low in calories. In addition to her cardiac issues, the healthcare provider also provided her with diabetes medications. They plan to continue this medication plan while overseeing her treatment because the diabetes medication combined with the meds for her cardiovascular issues could come with additional side effects, and it needed to be properly supervised with follow-up visits. She was similarly uninformed about self-management and the use of technology, but by using telehealth visits to assist with the management of her condition, she was able to get feedback from a provider on medication management in a way that was easier for her and took less time than a conventional office visit. This made her feel more empowered to discuss her medications and work toward having some removed as her condition improved. This evaluation shows that I was able to successfully define the reasons for Jessica's noncompliance and applied solutions by using evidence-based practices I've learned throughout this class. Jessica, who had type 2 diabetes, and her family were satisfied with this course of action. I discussed how the plan would assist with an increased quality of life and overall well-being. She perceives that being positive, participating in a plan of care, and following through on goals she set remarkably helped her further develop her well-being and compliance. She continued to work, ate an improved diet that she helped plan, used an insulin pen to administer insulin, used a fitness watch to monitor her fitness and heart rate, and used a glucometer to check her glucose levels. These changes decreased the impact of the disease on her life. Toshi and Munchie, 2020. Jessica's mental health has also improved her cardiovascular and diabetic outcomes. She ensured that being compliant and practicing good mental health practices made her quality of life and work life less complicated by her diabetes. These interventions are crucial to the patient's life in a variety of ways, including reduction of heart problems, weight problems, and mental health well-being. The treatment assists people in self-managing themselves and their glycemic progress. She is happy that she can maintain herself without constantly visiting her healthcare provider. Jessica, the volunteer, is not an active patient and volunteered to work with me on this project. I've not been paid for any time I have worked with this individual on a volunteer capacity. Use of evidence and peer-reviewed literature. Evidence-based practices decrease incidence of hyperglycemia and its effects in communities include the utilization of informatics and technology upgrades by patients and clinicians, Fonteca 2022. Confirmation-based approaches to decrease hyperglycemia and its inclinations in today's communities incorporate informatics and execution overhaul by patients and clinicians. Lee et al. 2019. Patients with type 2 diabetes mellitus are guided by extensive diabetic medication management to preserve their best health. Vane 2021. An evidence-based quality improvement initiative was started that reconfigured monitoring methods, albeit with electronic health records, EHR, trained nursing diabetes educators, dietitians, through medication adherence, decreasing of repetitive diagnostic procedures, and supporting documents of preventative measures. Valencia and Doles, 2021. To prepare to form a plan of intervention, I researched evidence-based practice and reviewed initial discussion with the patient. During the discussion and intervention, I expected to prepare the patient with an organized plan and prepare a discussion with her on its effectiveness and any barriers. Evidence-based methods now confirm that a counselor, educator, and interveners with resources for direction, encouragement, and critical help encourage success. Along with evidence-based practice, I moreover addressed peer-reviewed journals to assist with the progress of preparing. I recognize that the journals will ensure concise and reliable information. With this research, I applied information to planned interventions, and the execution of the plan did go well. Excuse me a second. Trying to make that a little bit better. Okay, so the level of leveraging healthcare technology. The utilization of information is constantly impacting of how the clinical benefits are given. Clinical specialists should look for novel ways to manage the work. I used EHRs, electronic health records, to store and access my patient's clinical information for clinical benefit. That helped me to stay compliant with HIPAA and knowing the data is secure and accurate. The advantage of taking on EHR consolidates my time, and I had the choice to get a good deal of information for intervention. It also safeguarded me from losing my patient data. Me Too, 2018. I measured the blood glucose levels with the glucometer. There are various types of machines that all help the patient to monitor the levels that they feel is necessary. Similarly, insulin pens for medication administration help in giving the appropriate ordered insulin amount. I used FaceTime to talk with my patient since she gave me several options to contact her. I also gave her instructions to be able to set up telehealth visits with a nurse practitioner to more frequently monitor progress and barriers to her treatment. The patient liked being able to discuss her barriers before they became a major issue, and it helped to prevent more visits to the acute care hospital. Also, assisting with education through the internet, online support groups, and researching reputable education on their chronic illness. These advancements can provide better wellness and monitoring for increasing their quality of life. Me Too, 2018. The influence of health policies on the implementation of the Capstone project. The culmination project is, in a general sense, impacted by several treatment methodologies. Assuring HIPAA policy was followed to assure that patient privacy protection was a start. Carefully considering decisions simplified for me with the use of new technology like glucometers, fit watches, telehealth, and internet support groups. They assisted the patient to learn the best way to manage care themselves, empowering them to manage their medical decisions. For continued progress in my assignment, it looked at technology, medication compliance, patient satisfaction measures, and quality improvement methodologies. For instance, the American Diabetic Association gave experts a procedure that requires an execution of new technology, continuous glucose monitoring, CGM, and a medication plan that will reassure patient of the safety and benefits of the compliance of prescribed medications. Moreover, the evidence-based ideal practices or procedure choices for the neighborhood clinics are summarized in the CDC site when proposing techniques for management of care. Center for Disease Control, 2019. As a person holding a bachelorette degree, I will have to consider all these things when preparing my presentation and following health policies. Policies such as the Affordable Care Act, the ACA, will have an impact on presenting an appropriate plan for management of care. Same with regard to Medicare and Medicaid. Policies affect reimbursement for patient management and can affect the barriers that they may have. As a result, I completed my efforts by strategies to do whatever it took to abide by those rules and regulations. Adhering to the guidelines seemed important in the field of patient responsibility. As a nurse, I ethically considered all rules. The moral standards for therapeutic process must be kept in mind. Whether project outcomes match initial predictions. The study's first results align with the initial expectations of an area where the level of transparency gives the desired result. Personal care monitoring and innovative adoption of technology into the management of care significantly improved Jessica's health. Also adding in diabetes education to assist Jessica to make better food choices and also to set a physical fitness goal that worked with her work and her home life. She can minimize her heart, mental health problems, and regulate her sugars by maintaining those goals she sets for herself. My time I spent to complete the research was successful. It gave me the evidence-based practice needed to support intervention and lead to the successful implementation of this intervention. Because it has strict adherence to regulations and policies in nursing education and can be used to treat type 2 diabetes, it has proven a comprehensive strategy. Furthermore, surveys have shown that this technique can be applied to other chronic illnesses and patients. Alcantara, Aragon v. 2019. Personal and professional growth as an RN to BSN. After completing my project implementation, it will help me to transition from RN to BSN in the near future. It provides a good understanding of all the rules of ethics for BSN. I now understand the importance of nursing regulations and ethical guidelines for implementing treatment plans from a personal and a professional standpoint. I hope to avoid mistakes made by other nurses by applying these practices, following protocols, policies, researching evidence-based practices, and working with my interdisciplinary partners to ensure the best care will be given. As a prospective BSN, the insights I gained regarding measures to protect patient and enhance healthcare practice are helpful. I know all ethical needs, including honesty, fairness, autonomy, governance, and clinical judgment. As a prospective BSN, I have learned clear communication skills that will be helpful and important in the future. I have discovered the importance of quality care and support programs to provide safe and affordable medical care. Yatabe et al., 2018. As a result, Northwest Hospital and this program is a bridge to my personal and professional growth. I have worked as an interim manager during my time completing my ADN to BSN. I've been able to use every single assessment in class to further my understanding in lifetime. It's not been a hypothetical situation, but has given me so much insight into the care and planning of care for patients, providing quality and safety. It has also prepared me to educate and mentor the next generation of nurses. This has given me the tools to ask the questions that a new nurse needs to ask herself, to be the voice in their head, to further their critical nurse thinking skills. Conclusion. These ideas summarize all the details related to the engagement of the culmination initiatives. It shows how satisfied Jessica and her family are with the intervention results. This work demonstrated the nursing staff's function and the medical environment in the application of regulations. After doing this assignment, I learned a lot of new things that are useful for my BSN profession. This concludes my presentation. Thank you for your time.